I'm about to tell you something that might completely change how you think about high blood pressure. And honestly, it might make you a little angry because for decades you've been told the same story. Your pressure is high because you have too much fluid, too much salt, too much water in the pipes. So what do? They give you a diuretic, make you pee more, your numbers drop, and everyone says, great, and problem solved. But after 20 years as a cardiac surgeon, after opening thousands of chests, after holding diseased arteries in my own hands, I can tell you with absolute certainty that explanation is incomplete and sometimes dangerously wrong because hypertension is not a plumbing problem. It's not about how much fluid is inside the pipes. It's about the pipes themselves, your arteries. And what I see during surgery proves it every single time. When I cut into a healthy artery, it's soft, elastic. It stretches and springs back like rubber. But when I cut into the artery of someone who's had high blood pressure for years, it crunches. It feels stiff, rigid, almost like cutting into old plastic. Sometimes even bone hard. That's not a fluid problem. That's structural damage. And here's the part nobody tells you. Blood pressure pills lower the number, but they do not repair that damage. They don't restore elasticity. They don't heal the vessel wall. They don't make stiff arteries flexible again. They simply push the reading down on your monitor, which means you can have normal blood pressure and still have arteries quietly deteriorating. That's why people on medication still get heart attacks, still get strokes, still end up on my operating table, because the cause was never fixed. Only the symptom was managed. So today, I want to show you something different. Not how to control hypertension, but how to actually repair the vessels themselves, because once you repair the vessel wall, blood pressure often improves naturally, and sometimes dramatically. To understand how to do that, you first need to understand what's really happening inside your arteries. Let me take you inside the body for a moment. What hypertension really is. Your arteries are not simple tubes. They're living tissue. They have layers. The most important layer is called the endothelium. It's a paper-thin lining that touches your blood. And this layer acts like a control center. It decides how wide your vessels open, how much inflammation occurs, whether blood clots form, and how much pressure builds. When it's healthy, your pressure stays normal. When it's damaged, everything changes. But here's the part most doctors never mention. On top of that lining, there's something even more delicate. A microscopic protective coating. Think of it like Teflon on a frying pan. It's called the glycocalyx, and it's one of the most important and most ignored structures in your entire cardiovascular system. This tiny coating makes blood flow smoothly, prevents inflammation, protects the vessel wall, and helps your body release nitric oxide, the molecule that keeps arteries relaxed. When this layer is intact, blood pressure stays stable. When this layer gets stripped away, your vessels become irritated, inflamed, sticky. They lose their ability to relax, and pressure rises. So what destroys this protective coating? Not salt, not water, not too much fluid. It's things you probably experience every single day. High blood sugar spikes, chronic inflammation, processed foods, smoking stress, oxidative damage. Every spike in blood sugar is like sandpaper. Every inflammatory meal slowly erodes that coating, and over time, your arteries lose their natural protection. Once that happens, your vessels stiffen. They constrict more easily. Blood doesn't flow smoothly, and your body compensates by raising pressure. That's actually where hypertension begins. Not in your kidneys, not in your salt shaker, but in microscopic damage to the vessel wall. And here's the key point. No blood pressure medication repairs the glycocalyx. None. So even if your numbers look good, the damage can continue underneath. Silently, for years. Until one day, heart attack, stroke, bypass surgery. That's the pattern I've seen hundreds of times. And it's exactly why we need a different strategy. Not just lowering numbers, but rebuilding the vessels themselves. In the next part, I'm going to explain something even more important. why stiff arteries, not high numbers, are the real danger, and how something called pulse pressure might predict your risk better than your actual blood pressure reading. Most doctors never talk about this, but once you understand it, you'll never look at your blood pressure the same way again. So now you understand the first problem: damage to the vessel lining, loss of that protective glycocalyx coating. That's where hypertension starts, but what I'm about to explain next is what actually makes high blood pressure deadly. Because here's something that might surprise you. The number itself: 140, 150, even 160. That number alone is not what scares me as a surgeon. What scares me is stiffness. Because stiffness is what kills. Let me explain. The mistake almost every doctor makes when you go to the clinic: they wrap the cuff around your arm and say, your pressure is 150/90. And immediately they focus on lowering that top number. But they almost never ask the more important question: how stiff are your arteries? Because here's the truth. You can have moderately high blood pressure and but flexible, healthy arteries, and your risk is actually lower. Or you can have almost normal blood pressure, but rock-hard, calcified arteries, and your risk is much higher. And most doctors never check for this. The shock absorber analogy. Think about your aorta, the main artery leaving your heart. In a healthy person, it behaves like a shock absorber. When your heart pumps blood, the artery stretches. It absorbs the force. Then when the heart relaxes, it recoils. It gently pushes blood forward. Smooth, controlled, easy on your organs, but when arteries become stiff, they can't stretch. So every heartbeat slams pressure straight into your system. Boom, into your brain. Boom, into your kidneys. Boom, into your heart. Every beat becomes a tiny hammer. All day, every day, for years. That's how strokes happen. That's how heart attacks happen. Not because of fluid overload, but because your vessels have turned rigid. The number nobody talks about: pulse pressure. Now here's something I want you to remember. It might be the most important thing in this entire video. Look at the difference between your two numbers. Top number minus bottom number. That difference is called pulse pressure, and it tells you how stiff your arteries are. For example, 120/80 pulse pressure at 40. That's healthy. But look at this. 160/70 pulse pressure at 90. That's dangerous, extremely dangerous. Even though the bottom number looks good. Why? Because that huge gap tells me the artery cannot stretch. It's rigid. It's calcified. It's aging fast. And studies show wide pulse pressure predicts stroke and heart attack better than systolic pressure alone. But almost nobody measures it. What I see in surgery. Let me tell you something from real life. When I'm doing bypass surgery, I can feel this difference with my hands. Healthy arteries, soft, flexible, easy to sew, but hypertensive, stiff arteries, the needle barely goes through and sometimes it literally crunches, like sewing into old leather or bone. I've had moments where I thought, this vessel looks 90 years old. Then I check the chart. The patient is 62. That's what hypertension does. It ages your arteries decades ahead of your body. What actually causes stiffness? This is where it gets interesting. Because stiffness doesn't happen randomly. There are 3 structural changes happening inside the artery wall. 1, calcium deposits. Calcium slowly builds up in the vessel wall, the same mineral in your bones. Your arteries literally begin turning into bone. 2, loss of elasticity. Elastic fibers break down. They get replaced by collagen. Collagen is stiff, inflexible, like rope instead of rubber. 3, muscle turns into bone-like tissue. The smooth muscle cells in the vessel wall actually transform. They start behaving like bone-forming cells. They actively calcify your arteries. Yes, your own body accidentally turns arteries into bone. And here's the part that might shock you. Blood pressure medication does not reverse any of this. Not ACE inhibitors, not beta blockers, not diuretics, not calcium channel blockers. None of them remove calcium. None of them restore elasticity. They only lower the pressure number. The stiffness remains. So you're still at risk. Just with prettier numbers, a real patient story. Let me tell you about Margaret. She was 72, on 4 medications. Her doctor said, "Your pressure is controlled. You're doing great." But something bothered me. Her pulse pressure was wide, and her CT scan showed severe calcification. Her arteries looked 20 years older than she was. She had controlled hypertension, but terrible vessel quality. If we didn't fix that, a stroke was coming. Not if, when. So instead of adding another pill, we focused on reversing stiffness itself. I'll show you exactly how in the next section. But here's what happened. 6 months later, her vessels were measurably more flexible. Her pressure dropped naturally. We reduced one medication, then another, then another. Eventually, she went from 4 drugs to 1. Not because we forced the number down, but because we repaired the pipe. That's the difference. And now we get to something even more important. Because there's one hidden mechanism that locks people into hypertension, no matter what they do. It explains why salt restriction often fails, why diuretics only work temporarily, why some people barely eat salt and still have high blood pressure, and why others eat salty food and stay normal. It has nothing to do with salt, and everything to do with insulin. And almost no doctor talks about it. Once you understand this, everything clicks. Now we come to the third mechanism, and in my experience, this is the one that surprises people the most. Because almost everything you've been told about salt is incomplete. You've probably heard this your whole life. Cut salt and your blood pressure will go down. And for some people, yes, that helps a little. But for many people, it barely changes anything. They avoid salt, they eat bland food, they feel miserable, and their pressure is still high. So they blame themselves, they think they're doing something wrong, but they're not. They're just being given the wrong explanation. Because for most adults over 60, the real issue isn't salt, it's insulin and your kidneys. Let me explain this simply. Your kidneys are like a smart filter. Their job is to decide how much sodium to keep and how much to release. If you eat too much salt, healthy kidneys send the extra out in your urine. If you eat too little, they hold onto it. That balance keeps your blood volume stable and your blood pressure steady. But here's what most people don't know. Insulin controls that filter. When insulin is high, your kidneys hold on to sodium, even if you don't need it. Even if you didn't eat much salt at all, they lock into retention mode. And when sodium is retained, water follows. Blood volume rises. Pressure rises. So the real question isn't always, how much salt am I eating? The real question is, why is my insulin high all the time? And this is extremely common after 50. You don't have to have diabetes. You don't even have to have high blood sugar. You can have perfectly normal lab results and still have chronically elevated insulin. This is called insulin resistance. Your body needs more and more insulin to do the same job. So insulin stays elevated all day. Morning, afternoon, night, your kidneys never get a break. They never release sodium properly. Your blood volume stays slightly too high. And your pressure stays up, no matter how many low-salt crackers you eat. I'll tell you about Robert. He was 68, very disciplined. He followed every instruction perfectly. Low salt, low fat, walked daily, took 2 medications, and still, 142 over 88. His doctor kept saying, "We may need a third drug." But something didn't make sense to me, so I checked something most doctors never check. Fasting insulin, not glucose. Insulin. His insulin was nearly double what it should be. That was the problem. Not salt, not fluid. Insulin. His kidneys were locked. So instead of adding another pill, we focused on lowering insulin. And what happened surprised even him. Within 2 months, his pressure started falling naturally. Not forced down, not medicated down, just normalizing. Eventually, we removed both medications because we fixed the cause. So now you understand all 3 problems? First, damage to the vessel lining. Second, stiff, calcified arteries. Third, insulin locking the kidneys. These are the real drivers of hypertension, not just too much water in the pipes. And once you understand the mechanisms, the solution becomes very logical, very calm, very practical, not extreme, not complicated, just consistent. So here's the simple 4-step approach I recommend to my older patients. Step 1, protect the vessel lining. I always recommend reducing refined sugars and highly processed carbohydrates. Not eliminating all carbs, just avoiding the big spikes, because every big spike irritates the inner lining of your arteries. I suggest focusing on whole foods, vegetables, beans, eggs, fish, olive oil, nuts, fruit in moderation, foods your grandparents would recognize. That alone often improves blood pressure within weeks. Step 2, support arterial flexibility. Your vessels need the right minerals. Magnesium is extremely important. Most people are low. Magnesium helps vessels relax naturally. I often recommend magnesium glycinate in the evening because it's gentle and well absorbed. Vitamin K2 and vitamin D are also helpful for proper calcium balance. They help guide calcium into bones instead of soft tissues, which may support long-term vessel health. These aren't miracle pills. They're simply nutritional support, like giving your body the tools it was missing. Step 3, restore nitric oxide. This is your body's natural vessel relaxer. The simplest ways? Daily walking, light strength training, even simple hand grip exercises. Movement creates healthy blood flow signals that tell arteries to relax. Also, something very simple. Breathe through your nose when possible. It sounds small, but nasal breathing supports natural nitric oxide production. Little habits add up, especially after 60. Step 4, lower insulin gently. This one changes everything for many people. I often suggest time-restricted eating, not fasting all day, just allowing your body longer breaks between meals. For example, finish dinner earlier, delay breakfast slightly, give yourself 14 to 16 hours without food overnight. During that time, insulin drops. Kidneys release extra sodium, blood volume normalizes. Pressure often drops naturally. No struggle. No suffering. Just biology doing what it was designed to do. Notice something important. None of this is extreme. No starvation. No crazy workouts. No expensive gadgets. Just small daily habits. But done consistently. Because consistency repairs structure. And structure determines pressure. And please hear me clearly here. I'm not telling you to stop medication. Never do that on your own. Medication can be helpful while you're repairing the system. Think of it as support. But these steps address the foundation. And when the foundation improves, many people find they can gradually reduce medications with their doctor's supervision. That's the goal, not fighting numbers forever, but helping your body work properly again. If this conversation changed how you see blood pressure, share this with someone older in your family, a parent, a friend, someone who thinks hypertension is just part of aging. Because it's not. Aging happens. But vessel damage is often reversible when you understand what to fix. In the next video, I'm going to walk you through one simple daily routine I personally recommend for people over 60 to keep their heart and vessels strong. Slow, safe, beginner-friendly. Something almost anyone can do at home. I think you'll like it. I'll see you there.